Hello everybody, in this video I'm going to make a bike block, and I've done this before in a couple of videos showing you how to make them. This is more a start to finish of a full lower bike block. I think it's good that everybody should know how bike blocks are made in the laboratory. You don't have to necessarily make them yourself in the clinic, but if you've got a setup and one of your nurses wants to do it or you want to have a go, I think it's really good to have a go, try it, see how you get on, and give you a little bit of a better understanding of what goes on. You don't need much equipment, you just need wax knife, a mechanical pencil and a lacron, some wax, induction heater and a bottle warmer. And if you're making dentures for patients, then providing them for patients, these are all sorts of things that you should have anyway. So first thing we do is wet the model. And by the way, if you're making a bike block and you're dealing with molten wax, always have a cold bowl of water right next to you, just in case you do burn yourself, and you can quickly stick your hand in there or throw it over yourself depending on what you've done. You don't want to soak the model in water. This has been drying over the weekend now, so it's quite dry, so you just want to dip it and then just quickly dip it, let the water soak in so that it's not saturated, because you want it to be damp so that the wax doesn't stick to it completely, but you don't want it to be too wet that the wax won't stick to it at all. The next thing we do is we measure the amount of wax that we need, score it, snap it off and then pop it in the heater. Traditionally we would have had a Bunsen burner and we would have been waving the wax through and trying to get an even softness of the wax, but these days it's a lot quicker and a lot easier to just use a bottle warmer. I set it at 53 degrees. Within seconds that wax is warm enough to just press down onto the model. I'm going to be doing lots of bike blocks over the next few months. I would like to do partials and things like that because they're a little bit more difficult in some ways. I'm using a lacron to trim off the wax. Now I've purposely not gone round the model with the pencil, just to show you. It's very difficult to judge where you should be trimming that wax back to without a line to guide you. So the reason I use a mechanical pencil is because you don't have to sharpen them, you just click them to make them longer as the graphite wears down. And I'm just drawing on the line in the ginjo-muco junction, which is where the soft tissue, sorry, it's where the connective tissue of the ridge joins the non-connective tissue of the lips, etc. So now I've drawn it because I can see clearly all the details and where the frenums are and things. Now if I put my wax back on, you can see straight away that I've gone over frenums where I really shouldn't have. The inside I've done is pretty good actually, but even after years of me making bike blocks, it just goes to show you just can't see the anatomy once you cover it with wax. So there we go, that's better. Once I've done that, I like to use a flame to fix this down. You can take it off, pop it back in the water, but I prefer to just flame it over with a little micro torch. So I'm just softening it up, not melting all the way through it, but softening it just to wet the wax. As the flame goes over, it just makes it wet, and then we can just gently tease it back in to where we want it. And now at this stage, to stop it from moving, I usually take my hot wax knife and then just seal it, not aggressively, but just seal it around the edges a little bit. just because it's going to make it really awkward if that comes off when we're trying to make the bike block. We need a little wire in there. Just want to heat that wire a little bit just so it tacks itself to the wax. Put that in to heat up in the bottle warmer. And again, just to make sure this doesn't move, I usually like to use a little bit of wax. Just to hold it so it doesn't move when we're putting the block on the top. Also, what this does, it stops or helps stop the block from bending too much or splitting around where this strengthener is. If you imagine I just put a block on top of that, the air is just going to get trapped in and around it, and so then it's not going to be very strong holding it together, whereas if you flood all those voids in with some wax, it makes the whole bike block stronger, especially if it's a little bike block like this one, if the patient's got a small mouth. And then we'll just take our wax. I like to fold it a few times, trying to keep the air out, and then I'll just roll it up. And while it's nice and soft, we just adapt it into the model. Now, I see a lot of bike blocks that are really thick and chunky. Makes them very difficult to use. For me personally, in the clinic, I like a nice thin, it could be a little bit thicker towards the back, but generally this is the thickness I like them. And the reason for that is it's just easier to work with. While this wax is soft, I'm trying to get it into a uniform shape. Now I've trapped some air in there. This is, when you roll it up, this is really annoying if you get like a bit of air trapped in there. So you're trying to get these side bits straight, and this bit at the front here uniformly round, following the arch but coming slightly forward of the arch. So when we get to that stage, as you can see, I've not been concentrating on the occlusal surface because that's all over the place. I've just been concentrating on getting the arch as neat as possible. Just use a stainless steel cutting board or placemat for when I'm doing the wax, because it makes it easier just to pick it up and boil it off rather than scratching the wax for the bench. I'd get my knife nice and hot. Careful where your fingers are when you're melting it off. And then I'm just looking down to try and get this plane nice and level. Okay, it's pretty good. Now with wax around the edges, I just melt it down into the base plate like that, and you're moving the model to control the flow of wax, making sure it's going where you want it to go. This takes a lot of practice. A lot of people commented over the years as I've been training people how to do bike blocks that I make it look really easy. But trust me, first time I did it I struggled like everybody else. Got wax absolutely everywhere. And also having the right tools as well. So the bike block I made last time, all I had was a stupid little wax knife, which just made it so difficult. And you need to make sure your wax knife's hot enough as well, because if it's not, all this wax that I'm melting like this when it's hot, it's just flowing in, making it easy. But if you try and move it around like this when your wax knife isn't hot enough, it will end up really messy. You'll get loads of air trapped in there, and then when you try and smooth it off afterwards, you'll get a really bad finish on it. So that's the basics done there. So all I do now is just build it up a little bit. We do this by just scooping up a little bit. So I'm putting that in to heat up. So you put it in, it's not green, you've got to somehow get your finger to heat it up. So annoying. Right, let's try again. Heat your knife up, lay the wax on. And you're just building it up to give it the strength that it needs. So I've got a load of air trapped in there because it wasn't, I'm sticking it in here, look, and it's not working. There's got to be a way of doing it. Look, you don't want to put your fingers right next to the blade because that's where it's getting really hot and you're going to burn yourself. So normally you'd be back here, but it doesn't work. Lay it on. Building it up like that. And I just want to thicken it up a little bit on the inside. So these induction heaters from Henry Schein, I wouldn't recommend them. My technician brain is whirling now. And I'm thinking, what can I do? How can I fix this problem? Because it's no good putting my knife there to heat it up. But there's nowhere, if I do that, it's going to overheat, isn't it? I just need something that I can just drop down when I'm using it. I'll leave it like that, maybe it'll catch fire and be easier to use. Anyway, there we go, just messing around with it now. So that's the basics there, and then we'd let that cool down, usually move on to another one while that's cooling. But in this instance I want to get going, so I'm just going to pop it in some water. Then we just tease it off. Use a tissue just to dry it off. The reason we dry it off is because if we put hot wax on it now, it's going to spit and splatter everywhere. But all we want to do with a hot wax knife, holding it so it doesn't drip on that fitting surface, just melt those little bits of flash. Put that back on the model. And we just give it a final flame over, and we just flame it over. Get that nice polished surface. Do white blocks need to be this neat? No. You don't need to worry about all the little air bubbles and having this perfectly flat and all the rest of it. But we do it because it's good practice. It's easier to do bite blocks and learn how to use the wax with bite blocks ready for when you go to learn how to do try-ins. There we go. I'll call that that. A lot of people think that's too thin, but for me, you think about the thickness of the teeth is one thing, so you know, teeth aren't that wide. But I've seen bite blocks like that. I like them nice and thin. If they're in the right place, it makes it easier in the mouth, gauging where the teeth are, where they're lining up. You know, if the patient's got a crossbite, it makes it easier to see that. but also makes it easier to get the compression when you're softening the wax. There's less wax, there's less mess, and I just find it's a lot easier to register the bite like this. And if it's not quite big enough, I can just warm up a sheet of wax and use a squash bite on it, and just use that wax to thicken it up in areas where I need to. But let's just say that the patient is not biting centrally and they've got a bite off to one side. When you've got wax this thick, you can just warm it up and you can literally just push it and manipulate it a lot easier than you can if it's a big, thick, chunky bite block. That's it. So now we'll disinfect it, get it wrapped up, and it'll be sent to the clinic.